Is somebody who develops schizophrenia more likely to become involved in violence and other crimes? Schizophrenia is a mental illness defined by challenges with attention, memory, thinking skills, and problem solving. Schizophrenia can also show prodromal symptoms, which can include intangible emotions of internal transformation and emergence of new interests, anxiety, irritability, anger, and depression. There's been various research into whether individuals with schizophrenia are more prone to violence, but it has been inconsistent. Research has shown that individuals with schizophrenia aren't automatically violent, but there are factors that can be associated with that illness to make violence more likely, including alcohol or substance abuses, being hospitalized involuntarily, or being admitted previously. There has been mixed research relating to whether patients with schizophrenia are more violent. One hypothesis that was found to explain this was the effects of organized delusions and how they would have driven a patient with schizophrenia to commit violent behaviors. Additionally, individuals with schizophrenia are more likely to have a risk for violence due to neurocognitive deficits, early behavioral abnormalities, substance abuse, and antisocial personality features. A study conducted in Switzerland found that there are certain types of stressors that can cause patients with schizophrenia to become more violent. The stressors involved that are most likely to cause violent behaviors is unemployment, homelessness, abusive relationships, and negative interpersonal interactions. These stressors cause feelings of rage, fear, or annoyance and can lead to pressure for corrective action. Patients with schizophrenia are naturally hypersensitive to negative stimuli, making them more prone to stress, and they have heightened emotional responsiveness to stimuli that arise spontaneously, but frequently lacks the behavioural control skills needed to manage their disorders, symptoms, and other stressors, which can further lead to violent crimes. A study by Rund 2018 researched various risk factors that can be identified within people with schizophrenia that can be posed as violent. One external factor found was substance abuse, which was proved to influence violent behaviour. Furthermore, it was found that patients with schizophrenia would commit violent crimes before seeking treatment. This highlights the fact that part of the reason for the violent behaviour is that some symptoms that they are displaying are unknown, so they feel stressed. Overall, the studies identified above have shown that while patients with schizophrenia could be deemed as violent, there is a low chance that it has come about independently, and that there are external factors/stressors that can cause the symptoms or illness to worsen due to the stress and anxiety. If somebody has schizophrenia and abuses substances, which one is more likely to make them start using violence? Several theories that explain why patients with schizophrenia have issues with substance abuse. One theory is the cumulative risk factor hypothesis, which suggests that patients with schizophrenia have an increased risk of substance use due to the combined impacts of inadequate social, cognitive, educational, and professional functioning in the context of poverty, victimization, and abnormal social situations. Researchers found that most of the time substance use begins before psychosis. It was found that patients displaying psychosis for the first time were more likely to be cannabis users and have smoked cannabis for more than 5 years previously. This is significant when thinking about the risk of violence because it implies that substance abuse is a risk factor that exists before schizophrenia and may interact with psychotic symptoms in the future. One study researched by Brown et al. Investigated the factors associated to violence and self-harm in forensic psychiatric patients. The research found that a history of drug abuse, co-occurring alcohol abuse, and schizophrenia were highly correlated with a number of violent crimes in the past. Fazal et al. 2009 examined the risk of violent crime among patients diagnosed with schizophrenia as well as how substance misuse influences this risk. The correlation between violent crime and schizophrenia was significantly diminished after controlling for substance usage, indicating that substance abuse was a significant mediating factor. This suggests that the substance abuse is the most significant risk factor for violence. A similar pattern was observed in a study by Short et al. 2012 examining crime and violence in patients with schizophrenia with and without multiple drug use disorders. The results from the study showed that the substance use disorder significantly increased the risk of criminal behaviour in both groups, while schizophrenia alone was still linked with some independent risk, particularly within the background of family violence. The presence of substance misuse significantly increased the chance of committing an offence. Overall, the studies that have been analysed have shown that substance misuse is a strong predictor for violent behaviour and has proven to have a negative effect on individuals with schizophrenia. To answer the question, substance abuse is most likely a factor influencing violence. Why might a convicted offender be sentenced to be treated in a secure hospital rather than spending a period in prison? If a convicted offender's crime relates directly to mental illness and a treatment is considered better than punishment alone, they may be sentenced to a secure hospital instead of jail. Mental illness can significantly affect a person's behaviour, decision-making, and interactions with the criminal justice system. The idea that the serious mental illness can reduce criminal responsibility is reflected in the fact that many jurisdictions also recognise not guilty by reason of insanity. Hospitals are generally regarded as locations for recovery and healing, whereas prisons are places of retaliation and punishment. Secure hospitals want to be able to have balance between therapeutic treatment and the necessary restrictions needed to keep the public safe. when mental illness can be linked to acts of violence. Secure hospitals are different to prisons as they offer long-term risk reduction therapy and rehabilitation. Research has found that forensic psychiatric services are more capable to address the needs of patients with schizophrenia. A systematic review by Fazil et al. 2016 found that patients released from secure forensic hospitals frequently show a decreased rate of reoffending in comparison to many other clinical and forensic groups. Overall, convicted offenders are put into secure hospitals rather than prison due to mental illnesses, which can increase the chance of them offending. Secure hospitals are a good way of being restrictive but can offer a therapeutic alternative to imprisonment and prevent violence from happening in the future. What kind of life experiences make it more likely that somebody with schizophrenia will become more likely to become involved in criminality? There are few life experiences that can make someone with schizophrenia more likely to commit an offence. One significant factor that can have an impact on violence in patients with schizophrenia is childhood adversity and trauma. One study conducted by Priest et al. 2020 tested whether polygenic risk score for schizophrenia engages with childhood adversity and stressors in daily life. The results revealed that exposure to childhood adversity in patients with schizophrenia had an association with emotion dysregulation and psychosis proneness. A similar study investigated whether their childhood adversity experiences had increased the risk of criminogenic behaviours. Most of the patients had a psychotic disorder as a fundamental diagnosis, with schizophrenia being the most prevalent. The results show that the physical abuse was one of the most common childhood adversity experiences within the patients. It also evident that increased levels of childhood adversity were mainly associated with increased violent behaviours. Another life experience factor that can have an increase in criminal behaviour in schizophrenia is social exclusion. Patients experiencing schizophrenia can express more negative symptoms, which leaves them with more of a risk to exclusion. Individuals with or without schizophrenia, social exclusion threatens moments of controlled self-esteem and meaningful existence. Another study used the virtual ball toss game, which includes two fictitious characters. The findings showed that the impact of negativity lasted longer within individuals with schizophrenia compared to those without. The individuals with schizophrenia are also reported that they were more likely to exhibit increased levels of anxiety, stress, and depression. A study surrounding women with schizophrenia was researched within the domain of cognitive functioning and homelessness. Results found that women with schizophrenia and the homelessness group were found to have lower cognitive functioning. However, the study did find that women with schizophrenia in homeless group had increased level of literacy skills and had past work experience compared to the other group. Another factor that can affect violence in patients with schizophrenia is substance misuse. One study investigated whether dual diagnosis, substance misuse, and severe mental illness is associated with aggression and offending. The results found that individuals with dual diagnosis were more likely to commit an offence than those with psychosis only. Overall, there are many life experiences, including child adversity, social exclusion, homelessness, and substance abuse, that can affect patients with schizophrenia and increase the likelihood of criminal behaviour. What kind of things can be done to make somebody with schizophrenia less likely to engage in violence or other offending? One of the main things that can lessen the chance of patients with schizophrenia becoming violent is by being admitted to forensic psychiatry. Within these places, schizophrenic patients can undergo psychiatric therapy and can be examined by psychiatrists to identify their risk and try and prevent future offending. The study researched by Fromberger et al. 2018 found that their intervention had achieved a low dropout rate from patients that had been deemed as a risk to the public. Psychiatric facilities do have positive outcomes, however, there are challenges that workers must face as patients struggle to cooperate during therapy. One study investigated the effectiveness of cognitive remediation and social cognitive training to try and manage aggressive and violent behaviours within patients with schizophrenia. The results found that the program had a positive outcome on the reduction and the control of aggressive behaviours within parents. From the results, they found that there was much effectiveness within the stages of illness. However, further research needs to be completed on these two approaches, but it has shown promise in being able to prevent violence. Electroconvulsive therapy can also play a role in managing violence in clinical practice, but there is limited evidence in the literature demonstrating its efficacy. However, the systematic review did find positive outcomes from using the electroconvulsive therapy. A study conducted by Gao et al. 2025 investigated the effect of cognitive behaviour intervention programs on violent behaviour in females with schizophrenia. There were a cognitive behaviour intervention group and a control group. The results provided that the cognitive behaviour intervention group did better than the control group and evidently showed that it can reduce the likelihood of violent behaviours. However, there are some limitations with this study, as it is very limited in sample size and only focused on females. Psychosocial interventions are another way to help violent offenders who are diagnosed with schizophrenia, specifically therapeutic interventions which can include trauma-informed formulated workshops to help the patients face trauma. Interventions like this result in the patient having an increase in self-esteem, self-control, and self-mastery, and it helps to reduce criminal behaviour. Overall, there are many interventions and therapies that can be used within psychiatric facilities to help schizophrenic offenders that struggle with violent behaviours. There are some more advanced methods than others, but some do allow offenders to open up about their traumas and it can have a positive effect on them as a person.